Gilby has a City and Guilds Further Education Teaching Certificate and is a tutor for ITEC, the International Therapy Examination Council, and a member of the British Register of Complementary Practitioners. Carol has a private practice in complementary therapies and teaches in England and Japan.
Right, these are just a few questions I'm going to ask you to make sure.
In this video, Carol will take you through an introduction to holistic reflexology, so that those who wish to pursue this form of holistic therapy will have a firm grounding on which to do so. The ancient Egyptians understood that the massage of pressure points in the soles of the feet generated reflex responses and conditioned responses to behavior. In effect, they discovered that a map of the internal body is registered in the feet. Today, that discovery has led to the development of a technique for relaxing nervous tension and assessing body imbalances through foot massage. Many conditions can be alleviated with reflexology. The human body is constantly trying to maintain homeostasis, or a state of balance. But due to stress, injury, bad diet, lack of exercise, and the resulting build-up or poor elimination of toxins, the body cannot cope, and sickness sets in. Patient off prescribed medications. And patients must not be told anything that may cause panic or distress. It is better to undertreat than to overtreat, and though therapists will make mental notes as they work, the patient should only be told what is necessary, and not everything that is found. Quite often, as one area of the body begins to heal, the other imbalances will take care of themselves. So it's not necessary to overburden anyone with diagnostic information. It must also be remembered that other complementary therapies can be used alongside reflexology, such as aromatherapy, herbal formulas, and body cleansing. Finally, practitioners of reflexology use a general terminology. Words such as congestion, imbalance, restriction, and area. As a therapist, it's wise not to specify what you cannot confirm. So, for example, if you diagnose a patient as having congestion in the uterus, it would be better to simply suggest congestion in the area of the uterus. They may have had a hysterectomy, and you could be picking up scar tissue. Equipment. Reflexology can be practiced anywhere, from a chair to a bed. So it's an excellent therapy for someone who's bedbound. As the therapist, you must be comfortable, and you must look after your back. So it's important that your patient's feet are the right height to work on. If you're going to use a couch, make sure that it's suitable for your height. Don't use one that makes you lean too far forward or stand on tiptoes. If you use a couch, you'll need a fitted toweling cover, a paper or cotton sheet, 2 large pillows, a large towel, and a smaller towel. If you don't have a couch, then a towel and a pillow may suffice. In any case, what you use is changed afresh for each patient. Your room should be warm, well ventilated, comfortable, and clean. And you should be professionally dressed with your nails cut short. Talc or oil may be used, though some therapists prefer to use no medium at all. What you use depends on your technique and preferences. Case history and contraindications.
Right, these are just a few questions I'm going to ask you to make sure that there's no contraindications, so that I know that it's safe to work.
Okay.
So can you give me your occupation?
I'm a merchandiser.
And have you ever worked with any chemicals?
I used to work in pharmacy.
So you were in direct contact with?
Yeah, you'd be sort of perhaps touching some of the tablets and some drugs.
How about any heavy lifting?
Not really, no.
So there's nothing else that's occupational that could have been detrimental to your health?
No.
It's necessary to take a good case history before any therapy is applied. And your patients should expect to answer questions on their general health. What the patient tells you will give you an insight as to their physical or mental condition. And from your case history, you'll know which areas to treat.
I'm pretty uptight.
Do you smoke?
No.
Does anybody around you smoke?
No.
You should also have a thorough understanding of contraindications, as they will affect your holistic approach.
When you get hot, do you...
If the patient suffers from diabetes, epilepsy, high blood pressure, or a heart condition, you may not recommend reflexology at all,
Nothing else?
or your treatment will be very gentle, with certain areas avoided.
How long ago did you work in France?
It's important to be trained to recognize when and when not to work.
What's your height?
The taking of any case history is governed by a code of ethics
Your body type?
and is strictly a private matter between you and your patient.
Right, what would you say?
You must not discuss it with anyone else without the prior permission of your
When you
patient.
get hot, do you...
Help your clients settle. Ask them to remove their glasses or contact lenses so that they can close their eyes and relax. Make sure that they're warm and comfortable. You may like to play some music. Ask your patient if they'd like to listen to music or not. Now support their legs by placing a roll or pillow under their knees, so that the lower back is flat on the couch and their feet are at the correct height to work on. Examine the feet for contagious diseases, such as verrucas or athlete's foot. Check also for bruises and cuts. Any open wound should be dressed before proceeding with your treatment. If a wound is too big, don't work at all. Wait until the wound has healed. Now clean the feet . And finally, wash your hands. Visual signs. Now you need to look at the feet and the way they fall. With your patient lying flat, the feet should fall slightly. If they fall out too far, the hip muscles may be slack, allowing for excessive joint movement and therefore excessive wear. If the feet turn in, there may be restriction around the hip area and to the blood supply. If one leg is longer than the other, the patient may have a tilted pelvis. With any suspect condition, a therapist should work in conjunction with an osteopath or chiropractor. Blood carries vital oxygen and nutrients, without which the body becomes diseased and underactive. Hard skin on the sole of the foot can indicate poor blood supply and degeneration in the related area. Equally, the temperature of different areas of the feet will tell you where the circulation is poor. If these indications are linked to the patient's case history, then you can assess their significance accordingly. For example, poor blood supply to the intestine reflex may indicate a lack of nutrient uptake, and therefore the whole body will suffer. Coldness over an area may be caused by stress, constipation, incorrect diet, or the poor elimination of toxins. So, as well as reflexology, all factors must be considered in your final analysis and will affect the recommendations that you will make to your patient. The color of a patient's feet is also an indicator of certain conditions. A blue tinge may indicate circulatory problems. Redness suggests inflammation. A white appearance may point to circulatory and lymphatic problems. A yellowish tint may be related to a liver condition. Look closely. The feet will tell you all you need to know before you begin working on them. You may also see raised areas. They may indicate congestion in the related reflex. However, you must be aware that this condition is also present in the hormonal cycle and returns to normal afterwards. So it's generally not a problem and is quite natural. Technique. There are two distinctive techniques for reflexology: deep massage and the walking technique. The walking technique can sometimes be quite grueling for the patient and also hard on the therapist's hands. Watch as Carol demonstrates. Deep massage is a bit kinder to the therapist and patient, and all the pressure points can still be triggered. You must choose the technique which best suits you and your patient. Whichever you prefer, it's wise to keep changing hands as you work, so as to prevent damage to your hands and wrists. Relaxation, left foot. Your patient's feet may be stiff, so it's important to relax them first. Make contact with both feet together and apply just enough oil to allow slip. Now cover the right foot. Shake the left foot with cupped hands from top to bottom. Open the metatarsal joints with your thumbs. Rotate the ankle joint both ways. Loosen the spine. Now massage the foot firmly to warm it up. The way you hold your patient's feet from the beginning will convey confidence in your treatment. All the time you're relaxing the foot, you should be making mental notes, monitoring how the foot feels and what this tells you about the health of your patient. Now it's time to begin working on the foot. Main technique, left foot. Start to work area by area, mentally registering what you find. First, loosen the joints. Pull the toes from the bottom joint one by one and rotate each toe as you work. Work from the large toe to the small toe. This sequence will give you an idea of any problems in the head and shoulder area. Exert thumb pressure onto the pituitary reflex and hold for 3 counts. Then repeat. This can be quite painful if there is a hormone imbalance, which can sometimes be seen by just looking at the area. Now work each toe all round, back and front, from large toe to small. This will tell you if there's possible cervical vertebrae misalignment, poor blood supply to the brain, sinus congestion, or a restriction on the shoulder area. Bend the toes gently back and work the eustachian tube. The eustachian tube connects the middle ear to the pharynx and equalizes air pressure on the eardrum. Congestion can cause discomfort and hearing problems. Now let's look at the esophagus and lungs, and the thyroid down to the shoulder girdle. We need oxygen and free-flowing body fluids to survive. If the lungs are not working efficiently, the intake of oxygen to the bloodstream will be limited, as will the elimination of waste products such as carbon dioxide. This has the knock-on effect of placing extra stress on the other elimination channels, like the kidneys. A build-up of body toxins results, so that the liver and lymphatic systems become sluggish, and the patient suffers from general tiredness, and if the imbalance is not corrected, ill health. The thyroid controls our metabolism, and an overactive thyroid may cause a hyperactive personality. More common is underactivity, which may cause tiredness and weight gain. Care should be taken when working on a thyroid imbalance, especially if the patient is already on some form of medication. Hormones can swing very quickly from one extreme to the other and cause unpleasant symptoms. Don't try to balance someone with a severe condition. Treating the lymphatic system. Drain the upper lymphatics between the toes. The lymphatic system filters our blood and helps provide immunity against disease and viral infection. Lymphatic fluid is moved around the body by skeletal muscles, which is why exercise is so important to keep the system in a healthy condition. If the system is allowed to become sluggish, toxins settle in the body, and the fluid itself stagnates. Cellulite is caused by poor lymphatic drainage, as well as by bad diet and underactive elimination organs. Cellulite tends to settle around the hips, because this is a poor area of circulation and is close to one of the major contributors of toxic body waste, the bowel. Congestion around the breast area can be relieved by working the axillary area of the foot. Now open up the joint and work the lymphatic area back the other way. Work the rest of the top of the foot with firm thumb pressure. This will aid general circulation. The groin glands and the reproductive tubes. Congestion in these areas is common. Pressure acting down from the weight of the top of the body impedes circulation to this area and allows toxins to build up. Massage up the leg to aid the drainage of toxins via the circulation. Now massage into the reproductive area and the medial aspect of the ankle. A point at the bottom of the heel relates to the sciatic nerve. Work the lateral aspect of the ankle. This is the ovaries and testes area. Now work round to the back of the ankle. This area covers the rectum. Working this area may help a patient with piles, but go gently as it can be very painful. Coming up the side of the heel, you'll feel a dent. This is the hip area. Pain here could indicate worn joints or sciatic pressure. Work all the way up the side of the foot to take in the oblique muscles, arms and shoulders. Move on to the base of the foot. Adrenals, kidneys, ureter and bladder. There is one kidney and one adrenal gland in each foot. The adrenal glands are part of the hormone system. They help control stress, muscle tone, blood pressure, blood sugar, and many other functions that may be in a state of imbalance. Therefore, the adrenal reflex can be very painful when worked on. Kidney infections will show up in the feet. The kidney on the right side of the body is slightly lower than the left kidney to make room for the liver. And this positioning is reflected in the area of each foot that you work on. Congestion in the bladder will register quite clearly. If the bladder reflex area is swollen, it may indicate infection or the buildup of bladder waste due to a lack of fluid entering the body. The spine is in both feet. The muscle tone should be quite firm so that the muscles are supporting the vertebrae. But there's a difference between muscles in good condition and tight muscles due to stress. When assessing conditions, allow for muscle tone. The bottom of the foot contains pressure points to all the internal organs. The diaphragm, which helps our lungs to work. The heart, which pumps blood around our bodies. The spleen, which is part of our immune system. The stomach, small intestine, and the colon, which form much of the digestive system. Everything must be covered thoroughly. The colon is registered in both feet. The liver, which is the chemical factory of our body, is in the right foot with the gallbladder. The lower back is on the heels of both feet. The skin is often hard and cracked. This indicates poor blood supply to the lower back area, which could possibly be due to bad posture, overweight, or injury, and may cause problems if it's allowed to degenerate. As well as maintaining a body in balance, our food should also be nutritionally balanced, eaten fresh, digested, and disposed of within 24 hours. Proteins, carbohydrates, and fats take different amounts of time to go through the body. This means that the colon should be working at regular intervals. Practitioners of complementary medicine, especially iridologists, believe that the bowel should be emptied every 6 hours. A young child or young animal does this automatically. As we get older, We educate our bodies to ignore these natural signals. Waste builds up in the body and will eventually cause breakdown and disease to take hold. When you've finished working the left foot, give a general massage and then cover it with a towel. Relaxation, right foot. Keeping contact, move to the right foot and begin relaxation. Work the right foot as you did for the left, all the time monitoring what's happening under your hands. Watch for the patient's reactions. Ask them to tell you if the pressure is uncomfortable. You can always go back to an area and repeat the massage later, rather than cause pain by overworking in one go. For example, if they've had a recent operation and the area is tender, there may be a strong reaction to pressure. Main technique, right foot. The technique you use on the right foot is exactly the same as for the left foot. So watch closely as Carol works all the reflex points on the right foot.